Autism is a developmental disorder which affects learning outcomes, communication, and socialization behaviors of children. World Autism Day falls in the month of April every year. Medicircle is conducting World Autism Day Awareness Series featuring eminent pediatric neurologists, speech therapists, and clinical psychologists from well-known healthcare organizations to get their views and to spread awareness on autism. Hi, this is Amrita Priya, and you are watching Medicircle. Today we have Ritika Agarwal on our show. Ritika is a consultant psychologist at Jaslok Hospital and Research Center, Mumbai. She has been playing an active role in creating awareness regarding mental health concerns through various mediums like written articles, videos, and workshops. Hi, Ritika. Welcome to Medicircle.
Hi. Hi, thank you for having me.
Yeah. So, Ritika, to begin with, how is autism diagnosed? Is there a specific test for it?
Okay, so autism is usually diagnosed clinically using the DSM-5. That is, the doctors look at the child's developmental history and the behavior to make a diagnosis. There are no specific medical tests to diagnose autism. Now, autism spectrum disorder can sometimes be detected at 18 months or younger, but by the age of about 2 years, a diagnosis by an experienced professional can be considered very reliable. Now, when we're making a diagnosis clinically, we're looking at an individual with autism must have concerns with two specific categories to be diagnosed with autism. Now, one is challenges with communication and social interaction, and two is restricted and repetitive behaviors, patterns of behavior, interest or activities, and these also include sensory issues. Now, I mean, that doesn't say much for a parent who's trying to figure, okay, do I need to get my child screened or not? So now what is it that you would look for? So maybe delayed speech or losing speech at around the age of about 2 years, or regressing a little bit when it comes to speech, not pointing at objects or not waving to people. So bye, hello, not responding to the name when called, difficulty interacting with others. So some prefer being alone and others want to play with others, but they don't know how to. So they might end up going and actually hitting the person or pulling the toy away without realizing there needs to be interactive play. There could be a repetition of words or phrases which are either said to them or they may use it in place of normal language. There may be repetitive actions such as either rocking the body, lining up the toys. So usually with trucks and all, they just keep lining it up either based on color or design or anything that they feel they connect to.
Okay.
They might have difficulty reading social cues, poor eye contact, not tracking people with their eyes, not imitating facial gestures, little to no imaginative play or make-believe games. They may also have unusual reactions to the way things smell, taste, feel, sound, and this can sometimes result in temper tantrums. And they also have difficulty adapting to changes in their routine. Okay. Now, having said that, autism is a spectrum disorder, which means that it appears in a range of forms and levels of severity. Yeah. So some individuals develop typical capabilities in terms of speech and language and develop exceptional skills in certain areas, but struggle with lifelong social and behavioral differences. Whereas others may have challenges in communication, sensory sensitivities, behavioral issues such as excessive tantrums, repetitive behaviors, aggression, self-harm. Now, because of this fact that it's a spectrum, I've often met parents who don't believe the diagnosis is true because no, I've seen a child with autism and this is not what my child looks like. So it's important to remember that it's a spectrum and not every child will present in the exact same way. Now, the DSM-5, which is the latest guidelines, have also brought the diagnoses of Asperger syndrome and pervasive developmental disorder under the umbrella of autism spectrum disorder. So that's again something that's new. And when you look at testing, so now we do have certain tests, but these are basically used to either screen the child or to identify the level of severity of autism. Okay. So, but they're not used to diagnose. So in India, for example, the popular tests that we use are the Indian Scale for Assessment of Autism, also called ISAA, or the Childhood Autism Rating Scale, which is CARS. And for toddlers, we have the Modified Checklist for Autism in Toddlers, which is called MCHAT. So these are just some of them that we use regularly here.
Okay. And what, according to you, causes autism?
Okay, so that's a little difficult because there is no single known cause of autism so far. Given the complexity of the disorder and the fact that the symptoms and severity vary, there are probably many factors. Now, research has so far found that both genetic and environmental factors play a role. However, these factors appear to increase the risk that a child will develop autism, but it's important to keep in mind that increased risk is not the same as a cause. So when you look at genetics, there are certain genes that appear to be involved in autism spectrum disorder.
Okay.
So if you look at genetics, disorders like Rett syndrome, Angelman syndrome, Fragile X, these children do have autistic features. And for other children, these genetic factors may increase the risk of autism. But some genetic mutations seem to be inherited while others occur spontaneously, which is something, again, that parents need to remember, because a lot of times it's a blame game when it comes to the cause.
Okay.
Next, when you look at environmental factors, there's a lot of research still being done, whether it's viral infection, what are the roles of medication or complications during pregnancy. And right now, there's still a lot of research being done to identify which of these can trigger autism. But having said all of this, I think it's important to point out that some genes changes associated with autism can also be found in people who don't have the disorder. And similarly, not everyone exposed to an environmental risk factor for autism will develop the disorder. In fact, most won't. Thus, the causes are still under research, and it's hard to pinpoint what exactly is the exact cause.
Okay. And you mentioned earlier that it's very difficult to identify similar symptoms in every child, because every child with autism has different symptoms. So what would you highlight as different types of autism?
Okay, so now there are no longer types. So like I mentioned earlier, the Asperger's disorder, pervasive developmental disorder. So all of these have now gotten combined under the umbrella of autism spectrum disorder. So we no longer have types anymore. However, there are still some people who prefer to identify as I have Asperger's or I have PDD. So it really depends, but clinically we don't look at types anymore.
Oh, I see. And what about the treatment options? Like, what are the treatment options available? And what would you advise to the parents of autistic children?
Okay. So again, there's no way to prevent or cure autism spectrum disorder at this specific point in time, but there are treatment options. So now the goal of treatment is to maximize the child's ability to function by reducing the autistic symptoms or features and supporting development and learning. Now, early diagnosis and intervention is most helpful, and this can improve critical social, communication, functional, and behavioral skills. However, it's also important for parents to remember intervention is helpful at any age. So a lot of parents, when they come to us, they say, it's really late, so there's no point now starting with therapies. It'll just be a waste of money. No, it's not. It'll still help you at any age. Yes, it will require more work on your side, but it is possible to still benefit the child. Okay. So the differences in how autism affect each individual means that each child has unique strengths and challenges in social communication, behavior, and cognitive ability. And therefore, treatment plans are also usually, one is multidisciplinary, and they may involve parent-mediated interventions, because again, parents are spending the most amount of time with the child at home, and target the child's individual needs, meaning intervention cannot be a one-size-fits-all. It has to be tailor-made to fit your child properly. Okay. Now, the best interventions or treatment options can thus vary depending on an individual's age, strengths, challenges, and differences. Now, I'm going to go into a few of the treatment options that are available at this point. So one would be behavioral and communication therapy, which helps with structure and organization. So as I mentioned, these children have a problem with any change. So many programs address the range of social, language, and behavioral difficulties associated with ASD. Now, some programs focus on reducing problem behaviors and teaching new skills, while other programs focus more on teaching children how to act in social situations or communicate better with others. So one type of behavioral and communication therapy is the applied behavioral analysis, which is ABA. This promotes positive behavior, and the children learn new skills and generalize these skills to multiple situations, which is, again, something that's difficult for them, through a reward-based motivation system. Now, it's also important to remember that whenever we try and reinforce a behavior, it needs to be in a positive way. The other type of therapy is occupational therapy, which teaches skills that help the child live independently as much as possible. And these life skills would include dressing, eating, relating to people. An occupational therapist would also do sensory integration therapy, which helps with the sensory issues such as body talking.
Okay.
Now, again, these two are things which it's very important for the parent to do these homework exercises at home. Next comes as speech therapy, which improves communication skills, verbal and non-verbal. Now, most times when you go to a speech therapist, the idea is to work on the verbal communication. However, when you're looking at children who have syndromes, speech is sometimes either very late or it doesn't come. In that case, we need to look at non-verbal communication. And today we have augmentative and alternative communication devices, which help on improving non-verbal communication.
Okay.
So again, because when you're looking at non-verbal, most parents assume that, oh, this is easy. Why do I need to, work with somebody and do this? But it's very important to learn how to use that device with your child. And once you learn it, you can continue at home. And we found that a lot of children have a huge amount of reduction in their frustration because they can actually tell you what they want. Otherwise, it's you assuming what they want. Another thing which is important is social skills training, in which the skills that they need to interact with others. So again, the conversation, problem solving. In certain cases, again, especially when it comes to syndromes, there may be motor milestones delay. So again, you need physiotherapy for that. Today, we again have music therapy, dance and movement therapy, and this can be used in conjunction with other therapies.
Okay.
So again, as I've also studied music therapy. So when I look at the children who we worked with on music therapy, I remember when my mother's also a music therapist. So when one of her students first came in, I hadn't started working as a music therapist. And this child would come in, would not want to talk to us, would just want all of us out of the room, didn't want any distractions. Today, when he comes in, he will actively look for us and ask, where are they? So he's able to make those associations today. And a huge part of it, again, is the therapies that he's been going through right now, as well as the family interventions that have been put into place.
Okay.
Next, you look at medication. So a lot of parents, when they come in, they ask, is there any medicine, just one tablet that I can give my child and they will be fine? So it's important to remember that medication does not treat the core symptoms of autism, but they can be given to help with certain symptoms, such as attention problems, hyperactivity, anxiety, seizure control, aggression. So these kind of issues are normally dealt with by a pediatric neurologist.
Okay.
Then you come to family therapy. Now, family therapy is something which I personally would recommend to most parents because it is something that is hard. It's a new diagnosis for your child. It's changed the way you function. It's changed the way your life is. And while it's good. So, for example, I recently, on World Awareness Day, Autism Awareness Day, I read about this analogy that came in about how I've been planning all my life, for example, a trip to Paris. I get onto the flight, I reach there and I realize I'm not in Paris, I'm in Italy. And though Italy is a lovely place, because I have not planned for that holiday, I am upset and I don't know how to deal with that and cope with it. And I don't enjoy my trip because I didn't want to come here. I wanted Paris. So for parents, it's the same thing. They've planned their whole life in X way. And now suddenly, while their child is wonderful, it's not exactly part of their X plan. It's a Y plan, and they need to refigure and reconstruct their whole plan in life.
Right.
So again, I usually recommend family therapy, and in India, because we, again, as a joint family, there's not just the parents who need to deal with it, but also the grandparents, the extended family. Everyone has a say in this.
Yes.
So in family therapy, parents and other family members can learn how to play and interact with the children in ways that promote social interaction skills, manage problem behaviors, teach daily living skills and communication. Because, like, again, I've seen parents come in, they're willing to work with the therapy, but grandparents will say, no, how can you let this happen? Just give the child what they want. How can you say no? Who did that? So the problem is, while the parents may be trying really hard to work with the therapy modules, it's hard when the other family members don't understand. In India, there's also a stigma around autism to some extent. So again, working with the family on that to help them understand, it's fine. It's another version of normal. And we all need to work towards helping this child and supporting him or her towards becoming the best potential of themselves.
Yeah.
So I normally recommend family therapy. And the next thing I normally recommend is joining a family support group. So this is a huge source of relief for the parents, because as and when new symptoms come up, or there's something new, is suddenly new behavior, because again, behaviors tend to change every 6 months for these children. And new parents are a little stressed out. He was doing this and now he's not, but this other issue has started. What can I do? And they may not always be able to reach their professional immediately. Or if they do, the professional may not know exactly what's happening, because they may have reached out to the wrong type of professional. But when you have the information available on the support group, you realize, okay, this is how others have been managing it. This is how I need to.
Yeah.
And you also learn new treatment options. So if there's any new research come out, so all of that kind of helps. And sometimes during this treatment options, it's very important to remember that certain behaviors, especially new ones that come up with no apparent trigger. So for example, you suddenly see head banging. You also might need to evaluate if the child is having a medical concern, because they may not be able to tell you that I have a headache or my ears hurting. So they may be using the head banging as a way to communicate, and it may not actually be any self-injurious behavior. So sometimes when you go into your pediatrician, you also need to remember the child is also a normal child, may have other medical issues, and you need to treat those as well. So I think that's it from a treatment perspective.
Yeah.
And when you ask me on what they can do to prepare their child for the future. So I think this is something, the most important thing I feel is that while we're so busy with this whole treatment process, especially just after diagnosis, we tend to get so wrapped up in working on their challenges and developing those aspects that we tend to forget that we need to also focus on their strengths. And that those strengths also need to be enhanced, because that's what's going to, again, make it easier for them. So I usually, again, tell parents to also focus on the good. And we also tend to focus on, you're not doing this properly, you're not doing that properly, but also remind the child what they're doing good. So I'm so proud of you for trying this yourself, whether they manage it or not, but they have tried, they have made the attempt. So reminding them and verbally reinforcing them is, again, something that's very important in terms of building up self-esteem. Another thing is, especially again in India, we tend to forget sometimes that the goal is to make the child as independent as possible. So a lot of times, no, I'm there, I'm the mother, I will do it. But why? Let the child try. The child will not succeed in the first round maybe, but neither did we. So keep letting them try. And this sometimes means making decisions that the child may not like. So for example, working on therapeutic exercises at home. A lot of parents struggle with this. So again, having said that, we need to make them do it. We also can try to modify the exercises to change the child's perception of that activity. So for example, we had a child who did not like blowing out candles. But then every now and then the mom would make a cake and put candles on the cake, and the child was very happy to blow it out, because it was either like a birthday recreation, or it was, just I get cake at the end of this. So sometimes we need to try and find fun ways to recreate these exercises so the child actually enjoys the activity and doesn't find it tedious. Another easy way is to make it a competition with other kids. So we need to figure out what works for our child and work accordingly. Another very important thing is enroll your child in a school. Now, based on the child's abilities, obviously the type of schooling would need to be chosen. And based on your multidisciplinary team, they would help you based on the evaluation that they have of your child. They would help you with figuring out which school would be a good fit. But this is important. And another thing is, when we're looking at planning for the child, most parents end up planning the educational aspects, but we're also looking at beyond education. So from a young age, we need to start looking at the child and thinking, what can this child do beyond education and career-wise? So, and then accordingly, obviously prepare them for the same, because it takes time for them to learn those skills. And this should ideally be based on their interests, strengths, and what is available around you. So, for example, if I was to look back at my experience, one child that stands out is this child with autism. He absolutely loved cooking. And he would follow his mother into the kitchen and watch her cook. And then gradually she noticed that he was telling her what to do, and sometimes passing her some ingredients which he knew she would need to use. And so she slowly started teaching him basic recipes, allowing him to cook basic, simple things which didn't require a gas under her supervision. And then she exposed him to a YouTube cooking channel where he now learns new recipes, and now he instructs her on how to make them. because he wants to eat XYZ.
Okay.
And whenever possible, of course, he helps her out with whatever. And so now the family is actually looking at planning his career as a chef, even though he's not even, I think right now, he would be about 15 years of age. But he's also pretty sure that he wants to go into this cookery line, and he would love to be a chef. So I think it's also important that when we look at this interest, we start cultivating that is from the early ages, rather than saying, no, but you have to be studying, so you can't be looking at cooking, just leave this and go study. So focus on their strengths, their interests, and use that to try and plan for the future. And I think the most important point I want to make is that individuals with autism have the potential to grow and improve. So it's important to find and start effective services, treatments, and education as soon as possible. The earlier these children receive appropriate treatment, the better their prognosis. And as I mentioned, it's never too late. Worst case, it'll improve their quality of life, which is still a great thing. And their progress, though slower than others, they can still live happy and productive lives with appropriate support. And isn't that what we all want? We all just want happy and productive lives, which is something that all children can have.
Yeah.
It's just about giving them that support and help and being there for them.
Yeah. So Ritika, you really explained everything very well. And what I gather is that no parent really imagines that the child will disorder like autism. But when a child is born like that, instead of being frustrated or instead of feeling low, it's better to find the good qualities in that child and enhance that skill, isn't it? So that the child...
Correct. But it's also important that at that time, remember, you're allowed to feel that way. Yeah. Because most parents end up feeling guilty that why am I feeling bad about this? I should be a better parent. But as I said, there is a normal transition period, in which case you are going to be overwhelmed, you are going to be anxious, you are going to be upset. You're dealing with a lot of emotions. And as a parent, you're completely allowed to feel that. And then okay, now I've gone through this gamut. Once I've come towards acceptance, now let me work towards what is possible rather than focusing on the negatives only.
Yeah. So enhance the skill of the child, look at the positive side of it, and what can be done. If it's there, live with it in a happy way.
Correct.
Yeah. So nice session, Ritika. We really learned from you. And thank you so much for being a part of the Medicircle show.